So when I did standard TMS, one of our fallback problems was at 3, 4, 5 months, patients were coming back almost where they started.
In today's video, we're going to be talking about, is TMS therapy permanent? With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, doctor, is TMS therapy permanent?
Well, TMS therapy is a daily therapy that goes on for usually a period of weeks, 30, 40 treatments. And the purpose is to repetitively put the patient into a brain state or to neuromodulate them over time. With standard TMS, one frequency is given to one location, and you're really forcing patients to go to that frequency. The idea is to overpower the system and make it listen and go to a 10 hertz frequency, which is the middle of the range. In contrast to that, PRTMS, or personalizing the dose, allows us to pick designer frequencies. And when we do that, it's more durable. So when I did standard TMS, one of our fallback problems was at 3, 4, 5 months, patients were coming back almost where they started. They had the benefit, TMS worked, but it wasn't as durable. To increase durability, you have to personalize it. And you got to pick patients' own shoe size, for example. If they wear a size 11 shoe, you can't ram a size 10 shoe on their foot. It won't stay. Temporarily, it'll stay. If they have an 11.2 hertz frequency, we'd rather propagate that signal, and it's more durable that way. And it also depends how you manage after we're done with therapy. Do patients continue to do bad behaviors and have bad sleep habits or use certain drugs? So really, it depends on how you treat your brain is how long it'll last as well. So when they finish therapy, we tell patients, let's change some routines here and improve your ability to keep this this new way we've made durable.
So more of a life change, behavior change to sustain the benefits that you've received during TMS?
Exactly. It's part of it. I mean, if you are, like, for instance, I treat concussion patients, and they'll go back and play football and smack their head 10 times and come back and say, I'm not sure the therapy worked. I said, well, you hit your head 10 times when I last saw you. So you want to, practice the good behaviors, and sleep hygiene is a huge one.
Yes.
Medication or drug use is a huge one. So if persons go back to their previous behaviors, it can degrade the benefit we had. That's true of any therapy. If you don't change your behavior, you can re-injure the brain, essentially. So in order to increase the permanence of the effect, we like to resonate the system into a alpha state using a personalized approach. And what that means is that I want each part of the brain to be on the same frequency, and I want the noise in each one of those areas to be minimized. The more noise I can remove, and the tighter I can build this waveform, and the more locations that have that waveform, the more likely it's durable. So you're essentially putting the brain in a very balanced position. And the more I can balance the patient, the more likely it stays.
It's more of a full brain treatment than the standard TMS one location.
True. So we'll treat areas that are not accessible by standard TMS. We treat the very vertex of the skull. With standard TMS, we'd cause seizure. We're about a logarithm lower in dose, meaning our intensity is so much lower, we have no risk of seizure. 10,000 patients on that area, we never had a seizure. We can treat areas then with longer duration of dose because we're giving lower energy. So it again allows us to customize the patient's delivery and the protocol based upon their response.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.